We'll take you live to Canberra now, where the Prime Minister is addressing the media.
Requires us to undertake a gear change of how we're managing the pandemic. We need to reset how we think about the pandemic and how we manage ourselves and the things we need to do as governments. Omicron is a game changer. It's been in the country for just over a month. We've taken the careful time to ensure that we're understanding it as best we can, examining the impact on our hospital system to ensure we're recalibrating in the right way so Australia can continue to live with this virus. That is our objective. With a population that has one of the highest vaccination rates in the world, an economy that is performing more strongly than most advanced economies in the world through COVID and one of the lowest death rates in the world from COVID, it's important that we stay on that track, and we do so by understanding each variant and then adjusting how we respond to that. And that's what we've done today in coming together as a national cabinet. Today we've agreed a very practical way forward to dealing with the realities of Omicron. It also recognises, as always, that all states and territories have largely different situations on the ground, but they largely fall into two camps. Those that have very low cases at the moment and aren't suffering the volume challenges that are presented by Omicron. Western Australia is an obvious case in those circumstances, and also are not suffering from the significant furloughing or isolating of workforce that is shutting down economies. Again, that's not happening in Western Australia, but it is significantly happening in the eastern states. So together we found a way forward. There is increasing evidence of reduced severity of Omicron, which is welcome news, and I'll ask the Chief Medical Officer, Professor Kelly, to take you through that. And I'll, of course, joined by General Fruin, who will take you through the latest status when it comes to the vaccination program. There is increasing evidence of reduced severity of the Omicron variant. And today there are 1,481 cases, individuals who are in hospital. There are 122 who are in ICU, and there are 51 who are on ventilators, actually less than the number I mentioned to you yesterday. We are seeing that the severity of this illness, the impact particularly on those who are in hospital in the most extreme illness situations, is remaining relatively constant. And that's an experience we're seeing in other countries as well. There are, though, the higher number of cases that we're seeing, and we will continue to see. That is the nature of Omicron. It replicates itself very, very quickly. That means we need to change who is a close contact, how they are isolated, and how their testing is managed. So today we agreed a new definition of close contact that requires testing and isolation. It'll come into effect in 5 jurisdictions at midnight tonight. It'll come into effect in New South Wales, Victoria, Queensland, South Australia, and here in the ACT. Tasmania will follow on the 1st of January, and the Northern Territory and Western Australia will be making announcements, particularly the Northern Territory, in the next few days to confirm how they will be moving to these new definitions. As I said, in Western Australia, it's a very different situation. Their arrangements at present can deal with the volumes, with their testing and tracing, because they have so few cases there. But we all understand that at some point that will change. And right across all states and territories, there was an agreement that this is the place that close contacts ultimately will have to be defined, especially when you're dealing with high numbers of cases. So we can expect those other jurisdictions to move to that definition when it gets to that point. And the definition for a close contact is as follows, very similar to what I said to you yesterday. Except in exceptional circumstances, a close contact is a household contact or household-like of a confirmed case only. A household contact is someone who lives with a case or has spent more than 4 hours with them in a house, accommodation, or care facility setting. So you're only a close contact if you are effectively living with someone or been in an accommodation setting with someone more than 4 hours with someone who has actually got COVID. Not someone who was in contact with someone who's had COVID. It's with someone specifically who has COVID. Now, a confirmed case would isolate for 7 days from the date. So someone who actually has COVID, from the date that they took the test, they would have to isolate for 7 days and have a negative RAT test, a rapid antigen test, on day 6 prior to being able to leave isolation after 7 days. A close contact that is symptomatic must have a PCR test still. So if you're symptomatic, and that goes for anyone who is symptomatic, by the way, if you're symptomatic, then the right test is a PCR test. A close contact who is asymptomatic, doesn't have symptoms, must have a rapid antigen test, and if positive, they must then have a PCR test. And in that case, they become a confirmed case, and the rules that apply to confirmed cases apply to them. Now, close contacts that return a negative test, they must remain isolated for those 7 days because symptoms and other things can present later. And that is 7 days from their date of exposure to the person who is a confirmed case. And they also will have a rapid antigen test on day 6. So, to summarise, if you are a confirmed case, 7 days, on the 6th day, you have a rapid antigen test, and if that's positive after 7 days, you can go back into the community. If you're a close contact, you get a rapid antigen test. If that returns a negative, you still remain in isolation for those 7 days, and you have a rapid antigen test again on day 6. If you're a close contact and you're symptomatic, go and get a PCR test. If you're a close contact that returns a positive RAT test, go and get a PCR test. Now, what this does is significantly changes those who need to be going and getting in queues. Now, particularly because this comes into effect at midnight tonight in 5 states and territories, if you don't fulfil this definition of a close contact, then there is no need for you to be in that line. You should go home. Go to the beach. Go and do what you want to do. Read a book in the park. Follow all the normal common sense things that you would do. Monitor your symptoms. Follow the COVID safe practices. Make sure you've booked in for your booster. Do all of those sorts of things. But there's no need for you to be in that line. The people we need in that line are people who need a PCR test. Now, we will transfer over the next few weeks from PCR to these rapid antigen tests at the state testing centres over the next couple of weeks. Larger states will be moving to get those rapid antigen tests to those testing centres as soon as they can, and that will happen over the next few days and next few weeks. So if you turn up at those testing centres for all the reasons that I've set out, then you will either get a rapid antigen test or a PCR test. If you're eligible for a rapid antigen test and there's ones there at that time, you'll be given one of those, you'll go home, you'll take it and follow those rules. If there isn't a rapid antigen test there, then we will still give you a PCR test in the transition. Now, if everyone else who doesn't need to be there gets out of the line, then that means we can get to those who need to have those PCR tests as quickly as possible. This should significantly, we hope, over the next few weeks, greatly reduce the volume of people who are having these PCR tests, which means we'll be able to increase the turnaround time of these tests getting the results back to those who need to take them. In addition to that, it will also free up, we hope, a lot more workforce that is currently being focused on these tests to be able to be supporting the other priorities for managing the pandemic, in particular the boosting clinics and centres for administering the vaccines. Those who don't need, if you're anything other than a close contact and you're not symptomatic, you don't need to go and get a test. Now, I know this is a bit different to what you've been hearing over the last couple of years. That's the gear change. That's the reset. That's what we need people to really understand. And I know it's a change from what has been said, but dealing with Delta is very different to dealing with Omicron. And to ensure that our public health systems work as effectively to keep as many people safe as possible, that's why we need to make this change. So you don't have to go and get a rapid antigen test if you just happen to walk past or go in and get takeaway or even be at a restaurant or a pub. You still need to check in because you want to monitor your systems. Anyone else who would like to get a rapid antigen test, well, you go along to your pharmacy or to the supermarket or the warehouse, big suppliers, where we believe as a result of making this change and being very clear about who is being provided with a public test and who is not, all the private industry who gave us that advice this week, they can go now, they can book their supplies, they can get them on the shelves and not have any concern that somehow a new policy will come in and tests will be handed out to anybody who wants one. It was agreed today that will not be the policy in Australia. Rapid antigen tests will be provided publicly at those testing centres for those who require one according to the rules that I've set down and we've taken out of National Cabinet today. We are also looking at a number of other specific areas where we'd be involved in providing. We already do it in aged care settings. We already do it in healthcare settings. That's done directly by the government. You'd expect that to continue. In addition to that, we are looking at vulnerable groups of people, particularly Indigenous populations, especially in remote areas. And we're also looking at how this will be done in schools. And so there will continue to be a role for public provision in these circumstances. Where possible, particularly for vulnerable groups, we would seek to do those through the pharmacy network and through the private network. And that would be done through a registration system similar to how we manage things like the PBS and things of that nature, which pharmacy is very used to dealing with. But for all other casual uses, you just think you'd like to get a test or something like that, well, that's what the private market is for. And with this certainty, knowing that they're the customers that the private market will have, then we believe, based on the advice we've had from the industry, they can go and they can make those plans and we can get them back on the shelves and we can get on with it.